Now we're going to briefly discuss what the PPACA proponents aren't saying, the seedy underbelly. And yes, there are alternatives that are out there. We're going to look. Does PPACA achieve its goals? Does it bend the cost curve down? Does it cover the uninsured? Because we want to cover the uninsured. Doctors do. Patients, we want that. We want people to get health care. We're going to look at the effects of PPACA on small business, doctors, and patients. So first, does it bend the cost curve down? Let's look at spending. On the left-hand side, you see what the CBO has published recently in 2012. $1.5 trillion new costs for Medicaid, CHIP, and tax credits for the subsidies for purchase of health insurance through the exchanges. This is going to be offset by $0.4 trillion in new taxes, and somehow this decreases the deficit $138 billion over 10 years. Now, and there is something within the CBO's accounting that says it's legal to count the cuts from Medicare as savings and effectively count it twice. Somehow it's legal, but it's not right. There are a lot of things that might be legal but not right, or constitutional, such as this law, but not good law. Now, there's a trustee of Medicare, and he has said, and his last name is Blayhouse, and I don't know if I'm pronouncing his last name correctly. He said that PPACA is going to increase federal spending by more than $1.5 trillion over the next decade, and is going to add $340 to $530 billion to our deficit over the next 10 years. That is not bending the cost curve down, and it is not improving the way that I take care of you. If I have somebody who comes in with a distal radius fracture or a wrist fracture, or if Dr. Rose has somebody who comes in with a distal radius fracture, we are going to know our patients better. I'm going to know whether you have a support system at home. I'm going to know what implants are available. I'm going to know how I can get you back better than a bureaucrat with some little pie chart. This isn't going to help. This isn't going to bend the cost curve down. This needs to be debated. Let's look at the uninsured. This is a chart that the Republican Policy Committee published in 2008. And this is very, very helpful. It basically divides the uninsured into the top half of the pie and the lower half of the pie. Let's glance at the lower half. The green slice. Individuals earning greater than $75,000 per year. Probably currently those young folks that come out, they're healthy, they're making good money, they're single, they're not really thinking about health care insurance. That's 9 million of the population that currently does not have insurance. We move down to the center portion of the pie. There's another 9 million or 9.7 million that are eligible for government programs, like Medicaid. They don't opt in. You move over again to the kind of beige piece of the pie, and you see another 6 million that are eligible for employer-sponsored health care, but again, choose not to. So this 47 million is now 23 million. Now we'll move to the top part of the pie. Let's look at the dark red. Legal immigrants, 5 million. Illegal immigrants, 5.2 million. And those that are chronically uninsured, 12 million. So, we've got 250 million Americans that are insured, 85% of which say they're satisfied with their health insurance. There's 12 million. Heck, you could even kick it up to the figure that you see this being bounced around the press, 30 million. That's still not a lot. Look at that, 95% insured, 5% uninsured. So, a CMS analysis in April of 2010 said at the final implementation of ObamaCare in 2019, we're still going to have 23 million Americans uninsured. So I would put out there that the President's healthcare law does not bend the cost curve down, and it does not cover the uninsured adequately. So this is the point that should be debated. let's look at the effect of the small business. I got this information from a friend of a friend who was asked to testify in front of Congress on the effects that the president's health care bill at that time was having on his business. Small businesses employ about 57.7 million. Large businesses, slightly more at 60 million. Small business hires about 43% of the high-tech workforce. For a small business, current government regulations cost approximately $10,585 per employee, which is 36% more than a large business. U.S. Chamber of Commerce study showed that 75% of small businesses see the new healthcare law as an obstacle to hiring new employees. I'm sorry for the long quote. It's wonderfully written, and I think it deserves to be read. The same small business owner. I thought that we were a partnership, meaning small business and the government. You create rules, laws, and regulations that are specific, reasonable, and ones that are understandable. They aren't meant to be punitive and destroy the backbone of America's small businesses. In return, we take calculated risks, we hire people, we build businesses that are profitable, and pay taxes on those profits. No government created a sustainable society by its government creating jobs and becoming a global economic model to emulate. Would you like a few reminders of abject failures? Russia, Cuba, the entire Soviet bloc countries, and North Korea. If you regulate us to death, surely you will suffocate us all, whether it be a small business, whether it be a physician, whether you're a patient trying to navigate through the regulations. At the best, ObamaCare will weaken our entrepreneurial fortitude, thus minimizing our country's sustainability as the world's greatest economic engine. At worst, we'll become a society dependent upon the government to make our decisions. There are 20 new taxes in ObamaCare, $500 billion increase over the next 10 years, 75% borne by those making $125,000 a year or less. Waverly, you still here?
I am over here.
Tanning tax. That has a lot to do with health care.
Don't even get me started. Don't even get me started.
So, this was some information that was published yesterday. This is an example of the effect of the medical device tax. Cook Medical, located in the mid-aspect of the country, I think it's Indiana, July 30th, announced that they canceled plans to expand 5 plants, stating that the $15 to $30 million that the medical devices tax was going to impose on them was preventing them from expanding their business. Now, why are we concerned? If you don't know enough already by listening to me thus far. More regulations. This detracts from our time to care for patients. Last week, we had our monthly meeting, 2 hours to discuss our, quote, business. Hour and a half was spent on discussing how we're going to comply with these new regulations. These quality measures, these number of prescriptions that have to be sent electronically for Medicare. I'm a hand surgeon. I don't write for blood pressure medications. I don't write for diabetic medications. You can't send narcotics electronically. That's going to be something that we can't reach. Does that mean I can't take care of my patients well? I don't think so. This drives us crazy. It adds to our overhead, all these regulations, because we have to employ people to make sure that we're complying and jumping through the hoops. We're frustrated as physicians because of the rationing boards. These rationing boards are going to place physicians in the position of violating their Hippocratic oath. And I tell you that many are going to leave. And if we don't violate the Hippocratic oath, we may suffer the consequences. And there are physicians that have seen and have been told by members of Congress that amongst the fines, amongst being excluded from the insurance exchanges, they've actually tossed around the idea of tossing physicians in jail. There is a propagation of the falsehood that insurance equals care. And that's not true. Let's talk about the doctor shortage. Right now, without the President's health care bill, there are 25,000 physicians graduating the United States medical schools per year. Right now, there are 35,000 per year retiring. That creates a deficit each year of 10,000. Investors Business Daily in 2009 demonstrated that 65% of MDs opposed Obamacare and 45% would consider retiring or leaving the country. There was a very popular study, which many of you probably have seen, by Doctors and Patients Medical Association, where they surveyed thousands of physicians and 83% surveyed they're considering leaving medicine because of Obamacare. I can tell you, I'm one, and I can tell you my brother, who's an OBGYN, is another. So Barack Obama is going to add 32 million patients. We're going to have a 30% increase in Medicare enrollees. We're not going to have a way to take care of people. So, Americans will have decreased access, decreased choice, decreased quality, increased wait time, and increased cost.